Hello, welcome to my channel. So today we are going to be talking about urethral strictures. So objectives we are going to cover anatomy, causes, pathology, clinical features, complications, investigations, and treatment. So starting with anatomy. So the urethra can be divided into two. We can have the posterior urethra and the anterior urethra. Then under the posterior urethra, we can have the prostatic urethra, meaning the urethra which is surrounded by the prostate. Then the membranous urethra. Then anteriorly, we can have the bulbar urethra and the penile urethra, which is sometimes maybe referred to as the pendulous urethra. So that's the penile urethra. Then under causes, we can have congenital causes where we have urethral polyps. We can have posterior urethral valves. Can have traumatic causes. So under traumatic causes, anything related to trauma which can cause someone to have urethral stricture. And we can have inflammatory causes. We can have instrumental. We can also have post-operative, such as during surgery. And under instruments, we can mention maybe catheterization. They may also cause urethral strictures. Okay. Then under urethral, the last cause we can mention is urethral infections, where such as gonorrhea. So where the urethral lumen may be narrowed due to a periurethral fibrosis and scarring, and the scarring may be composed of the dense collagen and fibroblasts. Then the periurethral fibrosis may extend to the surrounding spongiosum, which may lead to spongiofibrosis. So that's a pathology under urethral strictures. Then clinical features, we can have a poor urinary stream, straining to void, dribbling of urine, increased urinary frequency, incomplete bladder emptying, urinary retention. Those are some of the clinical features. Then under signs, we can have induration of the area of the stricture. We can have periurethral abscess, where and the patient may elicit a tender swelling along the urethra. Then you can also have a urethrocontiguous fistula, can have a palpable bladder, and enlarged kidneys. Then under complications, we can have retention of urine, urethral diverticulum, periurethral abscess, urethral fistula, altering perineum. We can also have hydroureteronephrosis. Then we can have trabeculations, diverticulum, can have prostatitis, can have also we can have calculi, can have hernia, can have hemorrhoids, can have rectal prolapse. Then under investigations, we can do urine microscopy, urine culture sensitivity, can have PVR, can have urethrometry. We can also have a retrograde urethrogram or a voiding cystogram. So these are some of the pictures for the retrograde urethrogram. Okay. Then under treatment modalities, so we have treatment modalities. Number one, we can mention, we can have dilatation with the use of metal dilators, urethral metal dilators. We can have urethrotomy, which may be followed up by self-dilatation. You can have stricturotomy, you can have urethral stents, you can have urethroplasty. So those are some of the treatment modalities. Then finally, finishing the tutorial with a case study. So look at the image shown and answer the following questions. A. What type of investigation is this? B. What is your diagnosis? Then C. What are the causes? Then D. How is the patient going to present? Then E. How are you going to manage this patient? So this type of investigation we've already gone through. This is more of a recap of a case study. So the type of investigation is a retrograde urethrogram, and the diagnosis is going to be urethral strictures. Then causes, so we're just going to mention causes. So we said causes may be congenital or acquired. Then you can mention to say they may have under the acquired, we may put urethral injuries. Under congenital, we mentioned congenital polyps, urethral polyps. Then we can have diseases under acquired, under congenital. Then under acquired, we can have catheterization or surgery that result in inflammation or scar tissue. We can have urethral infections such as gonorrhea. We can have a tumor in the urethra, which is very rare. Then urethral strictures can also occur as a complication of radiation treatment of the pelvis. Then the other question is, how is the patient going to present? So dysuria, hematuria, weak stream, spraying of the urine stream, then nocturia, incomplete emptying, pain with bladder distension, urinary tract infection. So they may present with fever and malaise if there is a urinary tract infection. Then how are you going to treat this patient? So treatment modalities. So can have optical urethrotomy, which is suitable for short segment urethral stricture. They can also have urethral dilatation. Can have urethroplasty. So we also mentioned others such as urethral stents and others as well. So that's the end of the questions on the case study. Thank you for watching, and please subscribe if you haven't subscribed, and share this video to people who might benefit. And see you next on the next tutorial.